You're live. Good morning. It's April 7th, and this is the Senate Health and Welfare Committee. This morning, we're looking at H660, which is related to the opioid abatement special fund, and look at the bill that's come over to us from the House, and understanding also that there are other things in the budget that relate to this. So we might have other work to do beyond the bill, but it's a good way to start. And was Sheila going to start on with us? Because Sheila's Katie.
It's up to you. Maybe I'll just quickly say.
Why don't you come on up and quickly say?
Okay, real quick. On the record, Noel and I will join fiscal office. I was making sure everybody still had a copy of this. I think this will be useful, especially for what I assume Sheila's presentation would be. Which again, just to reorient you with this has what the Vermont Department of Health recommended, what the opioid settlement advisory committee recommended, what was in the House proposal of human services, what wound up in the House as passed, and then it lists the agency or department that the particular initiative would be a part of, and then a short explanation of what it was, and then if those particular initiatives were older initiatives in previous bills, they're listed on the far right. So you have the existing initiatives at the top, new funding initiative at the bottom, and then on the back you have the reversions, and then you have sort of the bottom line of how much money is left in the fund after you do the spending. So I suspect Sheila's recommendation will just sort of be recapping what was in their recommendation and why. And so that should all be captured in the part as well. So just to easy reference.
Okay. And then the other thing that we've identified in here is the substance use prevention fund, which we are going to spend some time on as a committee. I know that the advisory committee tried to deal with that, but that's really not their jurisdiction, their place. So we're going to deal with that in here as a separate item, and we'll look just at the funding pieces that are in the bill. Okay. And Katie, you did go through the bill with us already, so probably don't need to have you come up again. So we'll go to the screen. And Sheila, thank you for being here. We appreciate it.
Thank you for having me. For the record, I'm Sheila Livingston. I'm an advisor in the Commissioner's Office at the Department of Health. Chair, may I ask a question?
Absolutely.
What is the large orange thing in front of the camera?
That's our dragon unicorn. And it's keeping an eye on all of us.
Understood. Thank you for the clarification.
There you go. It should be very frank. We're training our dragon.
Got it. Okay. So thank you so much for having us. I'm going to start with a tiny bit of background and move through. I did want to let the committee know, I did ask Dan Batesy from Department of Public Service to come in as well, because with this proposal and recommendation that the state has is from the whole state, not just the health department and not just the Agency of Human Services. So you'll see him in the room as well in case there's questions around their initiative. Next slide, Jessica. So there's two sets of recommendations, and that came out of legislation where the legislature requested that there be a set of recommendations from the Opioid Settlement Advisory Committee itself, and then a separate set from the health department. And I want to be really clear. We really deeply appreciate the amount of work that the members of the Opioid Settlement Advisory Committee put into their recommendations. They read 67 proposals from the community. It is not a formally paid position. They get per diem, but it's just a huge amount of work, and just really want to say thank you to them for what they did and put into it. So while the recommendations are different slightly, and I can go over that, I just want to really make sure that everyone knows that we deeply respect their commitment to this important money. So I wanted to start, so just those are both linked. You should have those on your iPads, but I'm going to go over just the health departments and then how the health department differs from what's in H660. So just to be clear, I'm not going to go through their recommendations today. Next slide, please, Jessica. So as background, this fund is complicated and it's so much fun because I get to spend lots of time with Nolan over the summer and fall as we debate how much is coming into the fund, what's coming into the fund. We work with the AGO. This is an estimate. So these are not solid numbers. I don't want anybody to use them for a specific budgeting in out years, but this is an estimate of what we think will be coming into the fund. It does not include any settlement that might come as a lump sum from a Purdue case, which may or may not happen. And these numbers change because companies can pay ahead of time and pay less. They can defer and blah, 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 blah. There's all these different machinations of how they can, complete the lawsuit and pay what they owe. And so this is, again, a guesstimate. What I would draw your attention to is that it's never over, or it's always under $5 million, right? Every year, the new money coming in is less than $5 million. And the amounts go down after 2032, kind of fairly significantly. Next slide, please. So having just said that, the legislature made it very clear last year that there are 4 initiatives that they want to fund ongoing, which is great. This is really helpful clarity. I appreciate that. Those 4 initiatives are reflected in both the health department and the OSEC recommendations. Now, I'm going to pause real quick because you're going to say, well, Shayla, the Burlington Overdose Prevention Center is not in there in either case. And the reason for that is carry forward. So outreach and engagement staff, you're going to see a line item recommendation that's far less than that total. And syringe services, same thing. Overdose Prevention Center, same thing. A lot of these initiatives have taken time to get off the ground, time to staff up, time to start funding all the different pieces. And so it's not we forgot or we don't want to do it. They don't need that money necessarily this year, or they didn't in the moment when we were making these recommendations. And I would really ask that the committee look at those totals. We are planning programming to hit those totals. So while we're not asking for that full amount this year, because we are trying to really be true to the carry forward and make sure we're asking for the right amounts every year, we will hit those numbers in out years. I would have the committee note, if you're doing the math, that we're going to hit $5 million here if we hit those numbers. And so, Jessica, if you could just go back one slide again. As a reminder, there's not $5 million coming into the fund every year. And so we're going to start spending down what you will see as like a balance in the fund. And so I just trying to really make sure everybody's aware. Right now, those limited 4 number of initiatives are already over what's going to come in every year. All right, slide 5, please. This is a lot of numbers.
Sheila,
and again, yeah.
Sheila,
Yes.
Can you go back? There's a question. Just please.
When you say the fund, is this money that is paid in, we put it in a bank account and then we allocate it? Or it's sitting there? Or is this a fund that is invested and is earning money or interest or something while it's sitting there?
Can I phone a friend and ask Nolan to answer that?
For the record, Nolan will join fiscal. This is a special fund, just like any other special fund from the state. So I don't know that our special funds are
Investing.
invested.
They're not in the treasurer's investment.
I don't know.
Okay.
I don't want to answer that. I would suspect not, because the money is in and out so quickly sometimes.
We'll find out.
Good question.
Were you interested in interest or?
Well, we're looking at it going down.
Yeah.
And we're funding ongoing programs with it. And I think we all hope there won't be another settlement, because we hope people, there probably will, but
Just one more.
we're kind of hoping that pharmaceutical companies learn and don't go pushing OxyContin on us, again. But it's looking at Shayla's numbers, at some point, we're gonna have to wean ourselves off of this, like the tobacco fund. There's less money coming in, and at some point,
Right.
we're gonna have to wean ourselves off of it.
So Sheila, a question I think that is implicit in what Senator Cummings is talking about is how many of the investments that we are looking at, but that are coming from this fund, how many of those investments are operational expenses to keep whatever is funded going? I mean, or how many of these are initial startup costs?
I love that question. Can I like pin that question? I'm going to get to it because it's so important. Is that okay?
Yes, it's critical. And so,
Yeah.
go ahead. Don't bother you. Go ahead.
No, great. No, yes, this is the point. So I really appreciate it. So I don't want to dwell on this slide because it's silly and it's not for sure, but it's to make the point that, again, if we're just spending those 4 ongoing fund initiatives at their full amount, we will run out of money by 2034 for that spending amount. And if we spend the amount that has been appropriated on average every year, which is upwards of $8 million a year, we would run out of money like next year. So to all of your points, we have to think sort of strategically and long term about what we're doing here, and not kind of continuously add. And that's a really important part of H660 that we really appreciated coming out of the House. That I'll get to in a second. Okay, Jessica, next slide.
Make a comment too, real quick. Yeah, sure. For the record, only with my fiscal. I would say the Human Services Committee was very mindful of this and sees these appropriations as each year as one-time appropriations. And the other thing Shayla probably going to get to, but I'm going to steal her thunder, is that one of the ideas behind this fund is that there's a program that appears to be successful that will be moved to base. For instance, there is an employment program, I forgot what it's called, that's in the VDH budget that was a previously an opioid fund initiative that has been deemed successful, and they're moving it to base funding outside of the fund. So that's kind of some of the rationale behind, I think, what the OSAC is thinking and what VDH is thinking, that these are funds investing in ideas, but one time basis.
Absolutely. I couldn't agree more. And so to answer the senator's questions about, ongoing versus one time versus, how are we thinking about this? A really a recommendation in our report to you all, and what is reflected in H660 is a request that we pause new projects coming into the OSAC committee for consideration for future funding, and instead focus their efforts and our efforts on evaluating those projects that have already been funded. Because I keep talking about those 4 that you all saw on that slide, but there's many more that have been funded over the last few years that would potentially need ongoing funding and don't necessarily have that sustainability plan on their own. And so we need to take a timeout from new projects and look at how the projects that we've already funded are doing, and then have the committee recommend to you all next year which of those should get ongoing funding, and then work with grantees to come up with other funding sources. And the state has to do a similar thing for the projects that we see as critical when there's other funding. And for Dale, that was true this year. So they had this really amazing, they have this really incredible employment project that works with people who are in recovery from opioid use. It's incredibly successful. And it's really contributing to long-term recovery for these individuals, and that this year is reflected in the governor's budget in base, and not in this fund. And so over time, and we're not going to be able to do it all at once, and I'm not making promises on like what year we'll do what, we will be trying to think of other sustainable funding sources for those projects that are truly successful out of this committee. I will also just mention, while I'm talking about the process that the committee uses, say that I think we need to, in that pause and in doing the evaluation in the future, if there is for some reason excess funding and we want to make changes or adjustments to what we're funding and take in new projects, I think we really need to consider with the committee, and we will work with them on this, how that happens so that it's not getting 67 proposals that are incredibly, can be very specific and very different, and having these folks try to sort through that. That's really complicated. It's hard. It takes a long time. And we have systems for that at the state through, competitive grants and other methods that might be better suited. So just talking to them about, instead of maybe those specific projects, having them identify specific bodies of work and directing departments towards, funding that work. And not doing that proposal process, which can be really tricky. Yeah, go ahead.
Yeah, this will be a longer discussion. So right now, what you're talking about is work that an advisory committee that is making advice about 1 year's use of funds that come in also become an advisory committee about base funding in the budget. And my concern there is that once you make that recommendation, it is a very firm recommendation. It also would have the support of the administration. And so my concern here is what other successful programs that we have started one time in the budget or other would be preempted through this decision-making process. So what my coming around to the end of my comment, this is a bigger discussion. And I agree with you. So I did hear you say this isn't something the committee can do. Totally agree. It is something for which the Department of Health and others have data. We could do that. But there's also are other organizations and other programs that might well need to be in base funding unrelated to substance use disorder. So we have to be careful about how far we go with an advisory committee on the funding piece. Just my preliminary thoughts, and you can bring me around somewhere else, but we need to talk about that globally.
I could not agree more. And I think one of the reasons that the pause on new initiatives is so important is to give everyone a minute to look at, again, what we've already put money into, right? Because the state has already committed money to starting up a whole bunch of different programs and actions that are, some of which are, doing incredibly well. And we need to see that, review that, and then have them come back to you and say, these are the ones that we want to keep funding. And maybe, Senator, you're right. Maybe we continue to use this money to fund those ongoing, because there's other budget pressures, which this committee cannot understand, see, or interpret, because that's not their job. Right. So I totally agree with you. And I think that that's why I have so much concern about the people seeing the principal or the amount that's sort of in the fund right now and saying like, oh, we have more to spend. And I get panicky because we don't have more to spend. We have like tens of projects that are in flight that we need to evaluate so that we're not either just shoving them off a fiscal cliff or, right, putting a ton of undue pressure on the general fund, which, like you said, has a lot of other pressures in it. So I think you and I are on the same page there completely. Jessica, can you?
That sounds refreshingly good. All right. And no one has comment.
Before she moves on to the next thing, I haven't answered Senator Cummings' question.
Oh, good.
So I phoned a friend, and in terms of special funds in general, they earn interest just like the rest of the state cash, so CD, short-term increments, etc. So not all special funds retain the interest earned on their balances. So unless otherwise specified in statute, the interest generally goes to the general fund by default. That's our understanding.
Okay,
So.
this is last few years, it shows that the interest has been enough. The economists to even count it. But with the high interest rates. Well, thank you. Okay, Sheila, why don't you go ahead?
All right, I'm going to continue on here. Jessica, could I go to, thank you. Top two here are the ones we've already talked about, outreach and engagement services. Very, very briefly, these are folks in our preferred provider network who go and do work in various different settings to try to engage people in substance use treatment. Really, really great, new, important, and has a lot of carry forward because it took a while for folks to staff up. So that's in everybody's recommendation. Recovery residences, you all know a lot about this, but 1.4 million, this is operational costs, and is sort of an ongoing pressure. I'm going to get into the weeds a little more on recovery residences in a second, because as you also probably know, we have Rural Health Transformation Program funding for recovery residences. And so we are going to ask you guys to make a small tweak to the language in H660 to just ensure that there's some flexibility there, because there's limitations on that Rural Health Transformation Program funding about what we can and can't use it for. And we would love to have this other, source to partner with it, so that we don't get in a place where we can't spend the RHTP money because programs need to make major renovations or do something that's not allowed with those federal dollars. So this is like a really important partner funding to that effort. And again, I'll tell you a little more about that in a second. Peer recovery and DOC, also in everybody's recommendation. This is something that is ongoing work. It's had various different funding sources, and we will continue to sort of try to sort out how to sustain this ongoing, because it's such important work to have recovery coaching inside the walls and in probation and parole. Really critical to create the connections to community and to treatment and recovery outside. The last item is support for emergency shelters through DCF. So this is specifically for folks struggling with substance use in our shelter system. Last year was $800,000. So here's one where we're trying real hard to ramp down and connect those shelters to services that are funded or existing in other ways and spaces. So you'll see us continue to try to move the needle on this and get those shelters really fully integrated to transportation and wound care, all of these different pieces that come into play when they are interfacing with folks struggling with addiction. And you'll see here, I want to just highlight that these recommendations for continued funding, all of these are statewide. So they are statewide programs, and we are, working with our partners in many communities across Vermont with these funds. So Jessica, if you can
Hold it, for Senator Bulick has a question.
Thank you, Shayla, for this presentation. I'm curious about that support for emergency shelters. That's a pretty big decline from 800,000 to 250. Will you be able to speak to us as to how you came to that number? What kind of data you gathered or evidence you put into coming up with that?
So a lot of that, Senator, is carry forward. So they got the 800,000 last year. Like all of these projects, right? It takes a while to get it going. It takes a while to start it up, get the grants in place, get the system set up. So they've got carry forward from last year. And we have really been working with them to try to find the problems and solve them with sustainable, durable solutions that aren't just this funding. So it's a combination of them both. I would not do a good job explaining exactly what those are, and would ask that you ask Lily Sojourner from OEO at DCF to come in and talk about that so that I don't mess it up.
So that's the question, is how does this link in with H 938 that we'll be looking at this week? So, if at all, but we'll try to find that out, but House Human Services has recommended the 250 that is here. Okay,
It's not the same questions, but that's okay.
do you have another question?
No, I'm just wanting to know more about that.
Yeah. Okay,
All right, I just talked your ears off about how there's not enough money and we shouldn't spend new money, and now I'm going to ask you for some new money. So, I think very importantly here, those are 3 initiatives that are one-time asks. So I think that's a really important distinction that we start to make going forward in this funding. This fund, excuse me, is where we can just say definitively this is not, ongoing. The first one is, again, more money for this recovery housing. This is for higher level recovery housing. So I think you all have heard about the different levels, how the supports increase in the residences as you go up certification level with VTAR for recovery housing itself. This is for that higher level end, and it's startup money that can't be, that we're not going to be able to use the RHTP funds for, or that will partner with those RHTP funds. The second one is buprenorphine off the back of ambulances. So this is EMS starting up the ability of EMS to provide buprenorphine when they respond to a scenario in which there's an opioid overdose or emergency. This is for training money. So we don't need to fund this as a ongoing service support. There's other ways for them to fund that. It is to get this up, going, and running in more communities in Vermont. And that last one is public safety enhancement team funding. And so this is to expand the PSET's harm reduction and strategic community intervention efforts in additional communities. And that's where I brought my colleague Dan in case folks had questions about that one. And sorry, importantly, the first 2 here are in H660 in various forms, and that last one, PSET, is not. So otherwise, all of the recommendations we had were included in H660 except for this PSET item. So you will see us request that again from you all. Questions before I move on?
so everything that you have been through is in 660. So then my question is, for example, the EMS dollars go to Department of Health, and then that will go through what process to get to the local level?
So it's training. We'll go through a grant making process. I think we have an existing system up with, I believe it's with UVM, but don't quote me. And we work with folks to go out into the communities and do the trainings to get this going. So it's not, again, it's not for services. I want to be really clear. It's for planning and training.
Okay. All right, thank you. I mean, so the appropriation that's in the bill, it's really an appropriation bill, doesn't have, it does link up with Department of Health and the current system for providing funds to EMTs across the state, but it's not elaborated. I just wanted to let the committee know that that's the way it is. Go ahead.
All right. So, those again, that was sort of our quote unquote raw recommendations that we made originally. Now I'm just going to very briefly talk about H660. So next slide, Jessica. Oh, yes. Whew, sorry. I got myself worked up there for edits. These are reversions. So you will see reversions in the bill. This is for 3 different projects. The first one is medication dosing unit in DOC. They figured out a different way to do it, don't need the money, are giving the money back to the fund. So because this is special fund dollars, if you don't use the money, it's not like, it doesn't like roll into your budget. It doesn't do that thing. We have to revert it back in, and we want to be able to obviously reuse it for something going forward. So we're asking to revert that 444 to the fund. Re-engagement beds, really important service. You all funded that with general fund last year, and that is a base appropriation for us. And so we have those re-engagement beds. They are operational. Everyone is really grateful for that service. Don't need it in here anymore. That's $1 million back into the fund. And then a wound care project. It was completed, and that remaining balance can be reverted. It's small. That's not millions. That's 8,000, just for those reading a small number on the screen. Any questions about reversions?
No.
Okay, now we can do what I was thinking I was doing next. So sorry, guys. So this is the OSAC process I already talked about. It is in the bill. Again, we really appreciate House Human Services, thinking about this, thinking through this with us. We will be working with the OSAC committee on what their process going forward. But I already gave you the rundown here. The idea is to look at those evaluation results and really stop and take a breath and look at what we're already doing and what the ongoing pressures are going to be, and how to transition those projects that need ongoing money to different sources. Next slide. Oh, sorry.
Question there on the last one, the RFPs. My understanding that the committee actually did use an RFP this time for a request.
Okay. Yeah, I can elaborate more on that. So I think our idea is to take the burden of looking at individual proposals and the readiness of individual organizations to do projects off of the committee, and instead, because that is like that, you all have set up processes, the administration has set up processes, right? There are requirements and bulletins and equity and fairness and all of these things that go into doing that in the way that we do that for all of our other money. And again, I want to really emphasize, I so deeply appreciate what the committee has done to date here in this space. But we are recommending that going forward, that instead of doing that and taking those individual proposals for one grantee in one specific town and one specific place, that instead the committee look at the evaluation results, look at the funding left over. If there is funding to be spent and to be used, they can recommend to you all and to us, right? We see a gap, and we think there needs to be this $2 million, making up numbers, right, spent on prevention prevention in schools. And then the state would, the health department would take that money, or, maybe that's for DPS, and they say, we think there needs to be $1 million spent on violence prevention, and we want to give it to DPS. And then DPS takes it and if you all appropriated it, and would do that RFP process, through our normal methods.
Understood. It does make sense given the volume of requests that have been coming in, and the work of the committee is not meant to be, an ongoing standing committee process. It's meant to be short term. Understood. Do you have recommended language? I can't remember whether it's in the bill or not. Do you have recommended language?
There's language in the bill chair right now, and I'm going to actually just call on my colleague Jessica, who's in the room. I believe we don't have edits to that language to offer. We're happy with what they provided, but I want to check with her. I think we have we have one small edit, and it's on my next slide, but it's not a big one. It's just a clarification.
All right, we'll look at that, because knowing what the committee goes through, the time allowed for that, and all the decision making, it won't hurt to have the process you're talking about, as long as we can ensure equitable treatment across the state.
Got it. All right, last slide, I promise, and then you can be rid of me. So these are our specific edits, and I want to explain them. Again, appreciated the bill that came out of House Human Services. The first one is there's 2 different line items for recovery residence funding. And it specifies regions, and it sort of like portions it out in a way that might be really tricky for us to administer in combination with this RHTP funds that we have now. And so our request is that we combine them and that we remove the geographic kind of boundaries so that that money can really be wedded in with the 8 million a year that we're getting through RHTP. Again, it's not, we are committed to the regions that were identified by the advocates that need new recovery residences. We agree those regions do need more recovery residences. This is not a disagreement with that. It is simply taking some of the ties off so that we can use all of our funding in the most successful and efficient manner. Section B4B, so this is that small edit that I was saying around the process. We do think that the OSAC committee should look at the evaluation results of all of the different projects that you all have funded, not just those 4. So we just wanted to be really clear about that. And you could read the language either way right now. And so our recommendation is that they not just look at those 4 ones that you all identified last year for ongoing funding, but really look at the evaluation results for the bigger, broader picture, because there are many other things, and one of them I will name that's really important is contingency management, which is how we treat stimulant use disorder. We don't have medication for stimulants. We're seeing a rise in stimulant use in the community, and contingency management is an evidence-based practice that this fund has funded and started, and it's like doing well, but it took a while to start up. So you don't see a recommendation for funding this year because it has carry forward. But, we would want the committee to be able to look at that as well. So that's, again, just hopefully just a clarification there. You heard me say already, PSET, we are recommending that we add in that $287,000 for DPS to continue that important work. Communities have been very responsive to those efforts and want to see that work continue. All right, the last one the chair alluded to. We would like.
I'm just looking at that last phrase, should be available to any previously. And immediately go to the OPC, which is a concern that we have, at least in my district and some others, about making sure that they're funded. And I would say they should be funded this year. So that's a consideration, but should be available isn't shall. I know that's a difficult word to put in there, given decision making that might happen. If something falls apart, you don't want to shall fund it. Understood. So we'll have to.
Yeah. No, sorry. And that's just our explanatory language. We're not recommending we write that in statute. We will change that. Yes.
Okay.
And then that last bullet you had mentioned before about the Substance Misuse Prevention Fund. So please stay with me here. Lots of funds, all the special funds that are coming, like you said, they're all slightly different. They all get funded slightly differently. And we want to be really clear about how we use our Substance Misuse Prevention Fund versus OSAC. And you guys heard our presentation on substance misuse prevention, how that money is being allocated, the incredible engagement from communities and our VPLOs, and how they're looking at needs assessments and data and like working on local level prevention efforts in a statewide manner that we've never had before. It is so exciting. We don't want to confuse this process that we've been using with that process, because that process, has taken years to stand up, and it is really starting to take off and work. And if we start to muddy it with kind of like specific call outs or carve outs, it's going to get really, really tricky, and it's going to cause some equity problems likely, and we're recommending no. In addition, this language is already in the big bill, so we the out of House Human Services, they were thinking of pushing some of the prevention recommendations from OSEC to SMPF. House Appropriations said no, took that back out, put it back in this bill that's in front of you today. We are fine with funding those specific prevention programs out of the OSAF funds, as they were recommended by the committee. That was not part of our state recommendations, but that's okay. We are not fine with starting to specifically direct in statute what communities do with their SMPF funds, through this other process that's not related. So we're asking for, please keep them separate. Please don't continue to sort of kind of call out these one project items. And we are happy to recommend or discuss additional language for the Substance Misuse Prevention Fund that defines it better and provides more clarity. Again, so long as we're not kind of doing this one-off picking at it is our big request.
We concur with your comment. And we've been talking about that with joint fiscal and others, so we need to stay in the same circle on this one. Thank you.
I think that concludes my monologue.
Okay, well, I know you had a lot of interruptions, so it became a dialogue here and there. That was good. Thank you for that. Committee questions then. This is really the overview of H660 from the perspective of DOH. Just one last question, Sheila. I don't know if it's the last question or not, but I'm thinking in terms of the proposal that the advisory committee made, and I know you talked about this earlier, but just to reaffirm that the advisory committee made, and then the Commissioner of Health either supporting or not supporting, was there agreement on the proposal?
Sorry, so the advisory committee had additional, they proposed more than what we did, and then they didn't propose the PSET. So the only points of disagreement, if you can even call it that, because again, I don't want this to be seen as contentious. It is not. There's no contention here. Is we would like to see PSET funded, and we did not recommend some of those other one-off programs. That is in your hands to decide. We're not opposed to those things. I would just caution again that whole ongoing money funding issue that we are facing.
Got it. And then the other question is, while you've spoken to the RHT issue and there's language that you're recommending that'll help offer flexibility within the bill itself. Okay.
Yes, and we can submit that language in writing, because if I try to pretend to do it orally to you right now, it'd be terrible.
And then the ongoing question for me, from my district, it's actually not in my district, well, a teeny bit of it's in my district, is the OPC and how that's going to be dealt with, knowing that once the venue is identified and things start working, it's going to happen fast. And perhaps there's a way to allow for the funding to be available, even if the legislature is not in session. I mean, if we don't pass something here that adds in the next year of funding, and all of a sudden it's required in Burlington, that could be problematic. So I'm thinking there might be a way to offer flexibility either through the Joint Fiscal Committee or something else, but I'm looking at Nolan.
For the record, Nolan, well, maybe Sheila can answer this, but the OPC has had $2.2 million appropriated so far. It's spent some of it. So this question is for Sheila. it hasn't been reverted, so is that money already available when needed? So it wouldn't need a special appropriation, it's already there when they need it? Or would they need
Should
some kind of,
be.
right?
Yep, you got it. So that's an area again, where there's a lot of carry forward and enough carry forward that the department did not recommend more money at this point for it. I think, Chair, you're saying like, what if they wanted to purchase a building, or what if they wanted to go and do something that had like an immediate, really big fiscal impact? And that is hard for me to predict, and not something that the department is specifically weighing in on. I know that legislators had a conversation with Burlington, the city of Burlington, and just I think we are here to administer that grant, and right now that grant does not need more money this year. That's sort of what I can,
Okay, well, we'll sort
at
that
its
out.
current burn rate.
Understood. And I understand exactly where we are with that, and we will continue to have a dialogue with you as well as with Burlington and try to sort out where they are and what's happening, if anything.
Absolutely, and we definitely want to have that clear communication. So here for that going forward. For sure.
All right, good, thank you. Committee questions, other questions? Go ahead.
I'm just, you've got what Department of Health just really said are existing ongoing projects, and the House passed, some increases on some of those.
Right.
And then you've got new funding, which you've got VDH with some recommendations, and the House passed more than the recommended for VDH. So if you go to the back, the total recommendation is 5.163 billion. Department of Health 0.6, and I think we saw early on how much money did we have this year, or was the budget? I mean, per year was coming in was 4 point something. No,
Yeah, I don't have that.
Well, the House passed expenditure of 4.2. The bottom line for the fund.
Yeah, it's 4.5,
4.5 million.
4.1, 0.7, so.
Yep.
4.5. Oh,
And the balance is right under the yellow. The unappropriated balance. Okay, which gives you a sense. And then there's a balance, what it would be after the bill. The bonds.
With 6. Okay. Okay.
the House passed balance is 6.7,
Yes.
which is lower than the House Human Services balance of 7.
That's because we're very much.
That's
Right.
And the two main differences between what PDH recommended and what the House passed are two pieces. One was the 850,000 for syringes.
Yeah.
And then the other piece was the 640,000 from the 4 other initiatives that were recommended by OSAC that House decided to fund that VDH did. And those are the same 4 items that the Human Services Committee was recommending go to Substance Misuse Fund and
Right. So 11, 12,
that's like 1.2 right
13,
there.
14, 15.
4.
Right,
That should kind of help point out where the
Yeah.
big differences are.
13 and 15. Okay,
But we weren't going to use thought that was discussed. We weren't going to use the substance misuse special fund dollars.
The House bill does not use that. Human Services Committee, I should say, sparked the conversation.
Right.
And the Appropriations Committee felt they didn't have enough information and to feel that they can dip into the substance misuse fund because it was already all allocated. So they sort of put it back into OSAP and sort of under the conversation.
Some decisions that will be made there against the process.
well, I think the recommendations from DOH are important to consider. And we'll have to go back through and go through markup on the bill. With that. And Shayla, go ahead.
I just want to say again, like, I think that the 600,000+ for those 4 prevention projects, I want to just be really clear that the OSAF, so this fund that we're talking about right now, this funding is in the lawsuit, in the statute, in the guiding principles around this funding. Prevention is definitely one of the identified possible funding, areas. And so it's totally fine and legitimate to fund prevention with this money. It's just that there is this other fund. And I think that House Human Services were like, oh, it's prevention, we'll just move it over here. And again, just to reiterate, sorry to repeat myself, that substance misuse prevention funding that you heard the prevention presentation on the other day it's all allocated. It is based on community needs assessments. It is with community input, and we would be like radically disrupting that process and that trust if we sort of started to mix these processes at this point.
We don't want to mix those processes at any point.
That's very
Yeah, we got it. Okay, we got it.
And we're not opposed to the syringe services. I just want to say, very fundamental public health program that is part of the ongoing recommendation from the legislature. It is something that we would want to fund ongoing. We had some pretty significant carry forward from last year, and that's why we did not recommend additional funding. So it, again, not opposed to that program, not opposed to that money coming in, and we would carry it forward again. And if it was not spent. So it's not a deal breaker by any means, like not close to a deal breaker.
Any other, I'm looking at folks around the room, and I'm gonna ask if there's anyone who would like to give a short comment now that we've gone through page 660 again.
Sure, I will.
Okay, you
Why
are
not?
first, Senator. The table.
So the syringe service is my understanding in my part of the state anyway, it's administered by the Howard Center, I believe. Is that correct?
Yes.
That's correct. It has been, and it is going to transition from the Howard Center to a different provider. They have decided to complete their program, and the health department is actively working on grants right now to sustain that programming for that population.
Okay, because I'm speaking for my community when I say this, not necessarily myself, but for my community, that it just seems like it's been woefully underfunded or under-resourced, or I don't know, something wrong with the way it's been administered. It's been super problematic. I just want you all to know that. I think my community supports it, but when it causes harm to folks living in our city, in terms of like the litter and it's just a problem. So I'm just sharing that, and I hope that we can improve it so that it works for everybody.
Yeah, I want to say, I think it's, again, I really want to emphasize, agree with you. It's such an important service, and we have heard those concerns and those frustrations from the community loud and clear. The governor, included some immediate response to that back in January, and we made some adjustments. But I think we are excited we moved this funding and this program to a different division at the health department, which sounds very boring, and is mostly boring, but we've got some sort of new energy behind it, some new folks on the ground working with the community in Burlington, specifically in Chittenden County, and we are excited to sort of try to reinvigorate the program with a new provider. And that's not, the Howard Center has done incredible work over the years. It's no disregard to them, but this is a moment where we can hopefully sort of re-engage in a productive manner.
Okay, thanks, Shayla. I hope you all can keep us posted as we move forward with this. Thank you.
Okay. Anybody else around the table first? Okay.
Gail Zatz on behalf of the AIDS services organizations. When we saw that the two entities did not recommend the 850,000, we dug a little deeper into it, questioned what the carry forward was. And as it had turned out, the base grants that the ASOs receive every year, the 850,000, was supposed to be added to those grants. It had never been added to the grants. So we were told that the reason why it was not added was because the organizations did not ask for the grants, which they had never had to do before. They were just automatically added. So they have now all asked for that money. We were told that given the fact that it is so late in the session, it is possible that if they don't spend all that money, it could roll over to FY27, but they definitely do need all of their FY26 money and all of their FY27 money. They made their case in the House before appropriations, as well as Human Services. Both agreed to include the 850,000 because there really is no carry forward. They do need money.
It's always more complicated. Go
Yeah,
ahead.
so
Senator.
I think I hear what Gail said. So because they didn't request it, that's the carry forward, basically.
Right. They have emails saying that the money will be added to your grants, but they never added them. So when they inquired as to why they have not been added, they were told that we have not received a request for them. So they have now all requested. They hope to all receive. There's not that much time left in FY26, but we've had numerous meetings and they have been very clear that they do need the money for the SSP.
So
for this fiscal
you're saying
year.
there is really no carry forward because we're gonna request it and the carry forward's gone.
Exactly.
Okay.
Other questions? Other comments? Okay, Jessica, go first.
Jessica Shabana, Policy Director of the Department of Health, and just want to follow on Gail's comment. We have been really working closely with the ASOs to make sure that they have enough funding to sustain their operations through FY27, and that's certainly a priority of the department. And as the money has transitioned to some new management in the department, we're kind of working out how that is going, but there is much money that's already available, almost 2.4 million that they will have in their grants, and we're processing that right now. So there is money available, but we support that, like in our conversations, they have identified that there will be this ongoing need in FY27. And so we don't oppose the addition of that 850,000.
We have a new positive working relationship.
We like positive working relationships. Great, thank you. Okay,
Yeah, my first action circles, I represent Recovery Programs of Vermont. Following that testimony, would just sort of remind the committee of one budget need that you wrote about, which is the 800,000 for recovery centers. That was funded with substance misuse prevention funds in fiscal year 26. Recovery centers certainly don't really care where the funding comes from, but it is a serious need. And they would be facing a pretty serious cut if they do not get another 800,000 this fiscal year. And so, you know, understanding the department's, the source of funds is less important. If there's like, we would be totally fine for that to be put in 660 with opioid abatement funds. But if it's not accommodated, just the centers will be facing a pretty significant budget shortfall this fiscal year.
what you're talking about is an addition to the 1.6 million that's currently in H660.
So the 1.6 million in 660 goes only to recovery, certified recovery residences. None of that money goes to our recovery centers around the state. They're different entities entirely, and the recovery residences have gotten good ongoing operational support in 660. The recovery centers do not have that operational support in 660. They are completely separate organizations and entities. So, and again, the 800,000 was in the prevention fund in fiscal year 26. we don't mind it moving funds. But it wouldn't be a new appropriation for fund for fiscal year 27.
Where would that be?
Sheila,
It's not in substance misuse fund for 27, is what you're saying.
It's currently not in the substance misuse fund for 27.
It would be on that chart.
That's
because
right.
It's on the substance misuse prevention.
The human services did what, that was one of the ones human services.
I understand that you moved into a budget request. Appreciate that because
I didn't mean to,
here.
yeah.
But be careful of that because we got too much going on. We need just to understand the bill. But I do appreciate your comments. And after Nolan and Sheila, and do you have something else? Sheila, after Sheila, I have a comment.
I just want to point out that the recovery centers are getting 1.25 million through OSAF for the DOC work. So that is money going to them through OSAF funding. And I think not for this testimony today, Chair, but happy to maybe sit down offline with you and with the recovery centers to just walk through some of the other funding sources and what's going on budgetarily there.
So that actually gets to my question. It would be helpful to know because I know Department of Health has last year and this year have been working very hard on sort of working out the statewide plan for recovery generally, whether it's a center or residents and what levels and so on. So it would be very helpful for us in this room to look at the plan that the department has so that we can all work collaboratively. Because I don't know what your plan is. And so what I see funding coming out of OSAC, and then I see money coming out of substance use prevention and money other places. So we see it through the appropriations process, which I must say is interesting, but it's highly frustrating not to know how it fits in with a broader plan. And then that also includes RHT. So is there a way that we can see that?
Yeah, I think that makes a lot of sense because I think like the syringe service funding has come out, was designated as coming out of here. That is funding that we have all agreed is going to come out of this fund and is an ongoing pressure that we will have to resolve before the end of this fund. And if the recovery centers really do need another 800,000, last year that was a one-time appropriation. It was pretty clear that was a one-time appropriation. And so if that's an ongoing budget pressure that we're going to have to consider long-term, I think we really need to have some hard conversations about if that's coming out of this money, if there's somewhere else, what that really looks like. And I agree that sort of looking at it and more holistically probably makes sense. I'm happy to come back and do that with you.
Good. Is there some written document that we could have in our hands?
That illustrates the plan.
I'm going to get back to you on that because if I say yes and then we don't have it, I will be very sad. So I will. Get back to you.
It's also smiling. So this is a question actually that I've asked previously. And it's not that we want to stop progress on this, but when it comes to making a decision about $800,000, we don't know where it fits. And so that doesn't help us at all. So if you could then please bring us what you have. And if it needs to be in testimony, we'll try to sort out some time. That is very okay. Thank you for that. That's been something on my mind for a while. It's good. Is there anyone else who would like to comment first? Others who haven't commented? That's you. And then
Thank you, Madam Chair. Dan Batesy, Deputy Commissioner of Public Safety. I'm just going to shell for the Public Safety Enhancement Team. I know that's a bit of a fuzzy topic from time to time, but I'll just say that this is the best work that we are doing with Public Safety Enhancement is through this project. And what this money will allow us to do is expand the good work that's happening. And I'll just point out that it is happening in all of your districts here, whether it's Situation Table in Burlington, whether it's the EMS Buprenorphine Project, whether it's any number of other pieces, all of that is going through the local collaboration that's happening through that Public Safety Enhancement Team. So
thank you for that work.
thank you.
We talked about taking that money out. And we're not going to.
Oh, well, good. Then wonderful.
Okay,
But I think it has to, and Shayla can correct me, but I think it has to be added back in from the last committee.
the
That's
last,
correct.
how much of that, Sheila? Where is that? Did you mention that?
Yeah, sure did. But yes, no problem. So it's 248,000 and it is not in the current version of H660.
Oh, dear.
So it would need to be added.
Is that number 8? Is that prevent? Is that prevent?
Public safety enhancement.
Public Safety Enhancement
That's
Team,
nine.
287,
Sorry.
Yeah, there's
and
nothing.
the House proposal was 0. So now we have to sort that out.
There is, I will say, there is enough money in the fund to support it. So you're not hitting any ceilings. But it was not in the House version and it is in our recommendations.
But it was in the committee, advisory committee, so the OSAC recommendation was.
No, it was not in the OSAC recommendation. So it was in the Health Department's recommendations, not in the committees.
Correct.
And it is not reflected in H660, but it is something we would like to add.
Curious.
That is curious.
Okay, do you want to make further comment about this program?
Other than just to say I'm happy, it is a little bit nebulous and it's a little harder. It's not like a single block of activity. I'm always happy to answer questions, and if you'd like me to come back anytime to chat a little bit more specifically, we'd be glad to.
Let me ask you a question then. So it would be 287,000 that would go to the Department of Public Safety. You would oversee that. Would you be looking at sending out an RFP at the local level? Or are you currently working with folks who have some public safety program?
So there'd be 3 areas where it would go. The first would be to expand situation table. The situation table now is 7 communities. We think there's probably room for about 11 or 12. And we've certainly heard from Orange, County, Randolph in that area, Morristown, a number that are already lined up to say if we had the money to do this, we would do it. We would also fund the data manipulation, which has been so central to our project, of working with CRG, Crime Justice Group, Crime Research Group, rather, and being able to look specifically at what of these interventions is really making a difference in the community. Because, as you know, we're doing a lot, but it's hard to measure it, and we have no formal metric of saying what's really making the most good and doing the best. So that's the second piece. And then the third piece would be to fund our consortiums going forward in the year. The consortiums, so if you don't know, Public Safety Enhancement Team is based upon the COVID response. So we put all of the weight of the state government. So ADS and Agency of Human Services and DPS, Public Safety, and any number of other organizations to say, how do we solve some of the chaos that's happening in communities? And then what we do is work with individual hotspots, as we call it, the places where we're doing the most work in public safety, to say, let's work with your community to help solve some of these problems. We've been in the Brattleboro, Springfield, Bennington, and we're now just starting in Barry and St. Johnsbury and Hartford, Woodstock. So we work with those communities. What the consortiums do going forward, we do them 3 times a year, is bring the local communities into a single room with the state enterprise in the single room and say, let's talk about what you're doing. Let's talk about how we can help. And although those aren't a huge expense, they're expensive enough. And we just want to make sure that that communication is going on, especially since we think the face-to-face is kind of important in these moments.
Thank you. That's helpful. So, Shayla, was there a reason that given by the advisory group that not to fund this? Or that was there a specific comment?
Not that I recall.
Okay, I know it's a long time ago.
Sorry. Yeah, they may have, but not that I could.
Yeah, okay. Well, we're not going back. Okay, thank you. So something for us to consider, committee, and then $287,000. You lifted 3 things, each one of which seems like a lot of work. Will all of those things be accomplished? But we're talking here startup funds.
Yeah,
We're not talking ongoing operational anything.
no, the good news is that most of ours are single ticket measurable items. So,
Okay.
we know that when we talk about the situation table, there's basically a startup and a licensing fee. Those are about $28,000 a piece. So I don't, forgive me that I don't remember exactly how the money in this budget was broken down, but that enables us to put a number of new tables in play. And then the cost of data manipulation is largely associated with CRG and their work they're doing with communities. But they've already worked with a couple of communities and had really good success. Brattleboro.
Which one do you remember?
They did a large overview of Brattleboro. I think they did another one in Springfield, but basically what they do is they go into the community. So PSET looks at really flawed data. We look at basically the responses to the community. But the problem is the responses to communities are not validated data. We're looking just at sort of like where we know the police and first responders are going to. But the problem is that it depends on how they enter the data. For instance, is it a domestic violence call or is it a sheriff serving papers for a domestic violence, offense that happened 2 months ago? We don't differentiate the two. CRT does, and they go in and say, this is exactly why we're here. This is exactly what your community is facing. This is exactly what the challenges are based upon the adjudicated, outcomes of these things. And they can do that at a much more micro level. And that enables the community to really take a hard look at not just what they think is happening, but what's really happening in their community. And I would suggest to you that separating some of the fact from the mythology is very, very important when we come to allocating resources. So that's the other piece of it. And again, that's pretty quantifiable and measurable. And then the consortiums are just, again, another expense that's, we'll give you an X number of them and
But if we are to even consider this, would be good to have a budget profile.
Yeah, I believe there exists one, Madam Chair. I'm afraid I don't know
Sure
it
there
off the
is.
top of my head.
No, understood.
Yeah, and I'll be glad to follow up to make sure you have that.
Helpful, thank you. Okay. Gail.
Have a different hat on.
Okay.
Gail Zatz on behalf of the city of Burlington. We are definitely requesting the additional $1.1 million for FY 27.
Is this a request going down the hall? Or is this something you're bringing in here for this fund and 660?
660
Another 1.1 million.
for
OPC.
yeah,
For which?
for the OPC.
For the OPC.
Yes,
Okay.
and we're gonna bring some additional information to the committee, hopefully by tomorrow, depending on meeting schedules.
Yeah, we'll put this bill up again and we'll go through it with markup, consideration of markup and decision making.
So that's in addition to what we're already doing
Yes,
for the opioid prevention center
yes,
in Burlington.
yes.
There is, so we'll have to get Nolan's input on this one. But there were decisions made, there have been decisions made each year, and it's a historical development of how it's been funded, what it's funded for, and the guidelines that the Department of Health has put out, and the agreement that Burlington has made with Department of Health. So there's a lot of historical data here. So maybe Katie and Nolan and Gail and Shayla can help us with that. Some of us have been here through it, and I know that you have not. So. Anyone else? Okay. So thank you for that. Katie, is there anything we missed in this bill? We need to. All right. Appreciate all of that. So we're going to take a 5-minute break and come back around 25 after. I know it might get longer, but we'll take a quick break. And I'm looking at Amy before we go. Do you want to make any comment at all on the Howard Center and the syringe program?
Not at this time.
All right. Okay, so let's